Hi, I'm Dr. Carl Chip Levy. I'm Medical Director of Cardiac Rehabilitation and Preventive Cardiology and Director of the Exercise Laboratories at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine in New Orleans, Louisiana. But I'm here right now in Rochester, Minnesota, because we're having our editorial board meeting this weekend, and I'm cardiovascular section editor and one of the associate editors. But I'm making this video right now to discuss one of our papers that's titled Sea Change for Omega-3s, Randomized Trials Show Fish Oil Reduces Cardiovascular Events, which we published online in October 2019 and published in the Mayo Clinic Proceedings print journal in the December 2019 issue. The first author of this paper is one of my superstar University of Queensland Ochsner Clinical School medical students named Evan O'Keefe. He's going to be finishing medical school and getting his MD degree in December. And my other co-authors include one of my cardiology fellows, Andrew Alagizi, and three very famous omega-3 researchers, William Harris, who is often referred to as the Codfather. So he's done a lot of omega-3 research, as well as James O'Keefe and Richard Milani. So a very esteemed group of co-authors on this paper. Now, there's been a tremendous amount of controversy about the role of omega-3s and fish oils in preventive cardiology over the last few decades. Certainly the major studies decades ago, the Gissi Prevenzione, the JELIS trial, showed tremendous protection against cardiovascular events in those patients randomized to omega-3 or fish oil therapy. But the results in more recent years have been quite different. Many of the individual trials, many I think were maybe underpowered, underdosed, but they ended up having negative results. And even the meta-analyses have been giving discordant results. And I'll give you an example. There was one big paper by Rios in JAMA a couple of years ago that actually had a number of beneficial effects with p-values of less than 0.05 for reducing events by somewhere between 8 and 13%. But they counted the paper as totally negative because they set the p-value at very stringent values like p.005, so much more vigorous than we would typically use. There was a recent Cochrane analysis that also basically reported negative results using many trials that were underdosed and even some trials that were just dietary recommendations and not even giving supplements. Whereas a recent meta-analysis by Maki and colleagues in Journal of Clinical Lipidology had an 8% reduction in cardiac events, which was, cardiac mortality, which was statistically significant, and one that we had in the Mayo Clinic Proceedings a couple of years ago that's been heavily cited by Alexander and colleagues that showed 13-15% reductions in events, especially in subgroups of patients who had hypertriglyceridemia or hypercholesterolemia. And Dr. James O'Keefe and I both co-authored an editorial on this important paper. But in our current paper, we review many of the recent evidence, but particularly three large randomized trials that were just completed: the REDUCE-IT, the VITAL, and the ASCEND studies. The REDUCE-IT trial is probably the best all-time omega-3 trial. It was a trial of 8,200 patients randomized to 4 grams per day of EPA, eicosapentaenoic acid, basically in the form of Vascepa, versus placebo, which was mineral oil therapy, in patients who were followed for 5 years. Most of these patients had hypertriglyceridemia. But the bottom line of this trial was about a 25% reduction in major cardiac events in those randomized to the high-dose EPA therapy, and reductions in coronary mortality, cardiac mortality, and sudden cardiac death by 20% and 31% respectively. Now, some people more recently are saying that the mineral oil placebo actually gave an unfavorable result to the placebo group, but most people are very impressed that this is maybe the most impressive lipid intervention study that when an agent was added to statin therapy that's yet been performed. And the results were just as beneficial regardless of the triglyceride response. So it certainly did not appear that the triglyceride response was the reason for the benefit. The VITAL trial was 25,000 people, randomized to basically a gram per day to form was Lovasa therapy versus placebo, also followed for 5 years in patients who were without cardiovascular disease. This trial only showed an 8% reduction in events, which was not statistically significant, so it was said to be a negative study. Despite the fact that there was a 28% reduction in mortality and a 17% reduction in coronary heart disease events that were both statistically significant, and MI death rate was reduced by 50%. And in the patients in the trial that consumed less than 1.5 fish meals per week, which was about half the trial, they actually got 19% event reduction with the omega-3 and a 40% reduction in their MI. So even though the investigators in this trial, including Joanne Manson and Harvard, counted this study as negative, we really felt that it had very important clinical endpoints, especially when you consider it was just 1 gram of omega-3 and it's a very benign therapy. The other therapy was the ASCEND trial of 15,000 diabetics who were randomized to, again, a gram per day of omega-3 in the form of Lovasa versus a placebo that was olive oil. Now, olive oil could have benefits, so maybe it was an unfair advantage to the placebo group. But this trial only showed a 3% reduction in events, and it was not statistically significant. So this was considered a negative trial too, despite the fact that vascular death was actually reduced by 18% statistically significant in the omega-3 group. So all of these trials had some, I think, very important beneficial effects. And so we believe that the constellation of data present now still supports the potential for omega-3 and fish oils to have beneficial effects in preventive cardiology. And we discuss some of the pros and cons and some of the positive trials and the negative trials in our article, and particularly review the evidence that the patients who get high blood levels of omega-3, they really appear to be getting the benefits of omega-3 therapy. So we really believe that the trials that maybe 1 gram a day could be helpful for somebody who has got high risk and consumes very little fish. But the results would probably be better in the groups who are getting 1 to 2 grams per day, or maybe 2 to 4 grams per day, like the Jellish trial and the Reduces trial. And we really believe that one area that's really been neglected is the heart failure trials. The GISI heart failure trial years ago with 1 gram per day showed very minor, although statistically significant, benefits in heart failure. But we believe if they use doses of 2 grams, 2 to 4 grams, and maybe even 4 to 8 grams in people with really advanced heart failure and cardiac cachexia, there would be a lot more potential for getting clinical event reduction, and these trials really need to be done. So at the present time, I really feel that the overall evidence supports omega-3, and it's reviewed in our article. And a quote that I read in New England Journal many decades ago basically said that fish oil is a whale of a story that seems to be getting bigger with each telling. And I think that's still true today. Thank you very much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.